cardiac masses. This one is, I'm going to do the very. So sometimes when you do CT scan, you see a mass in the heart. So you can see there's a big mass. So for orientation, the heart has 4 chambers, right? The right atrium, right ventricle, left atrium, left ventricle right here. And you can see this low density mass right here. You can see the mass extending from the ventricle in the atrium into the ventricle. And then you can see this mass right here is actually, this is a thymic carcinoma, a malignant thymoma that goes into the superior vena cava and then go into the atrium, extending into the heart. So the most common cancer that go into the heart is, metastatic disease, obviously, but you think of like renal cell carcinoma, you have to image the abdomen, and you look at the kidneys, and liver cancer too. Hepatocellular carcinoma can invade into the IVC, and it goes up into the heart. So you think of kidney cancer, liver cancer, and thymic cancer. So most common cardiac masses are metastatic disease. When you see a mass in the heart, the first thing you have to think of is metastasis. So this one, you can see the tumor right here in the right atrium, and then you can see the tumor in the IVC. And so that's a kidney cancer, renal cell carcinoma, right? So it's common, very common, and renal cell carcinoma metastasis. So this tumor is in the left atrium, right? And it's abutting and it's pedunculated. So this is the most common benign cancer, is cardiac myxoma. It loves the left atrium and sometimes the right atrium. So most common benign primary cardiac cancer lesion is a benign myxoma, and then most of them occur in the left atrium. I see maybe, because I do cardiac imaging, I see maybe 4 or 5 cases of cardiac myxoma a year in my practice. Okay, this is another benign tumor. So I don't do echocardiogram. I think there's something echogenic here, right? And then right here. So this looks like a fat. So on cardiac MRI, it has the same signal intensity as pericardial fat right here. This lesion right here. So this is a cardiac lipoma. It's pretty common too. So it's the second most common benign cardiac mass. So it has like fat characteristics on CT, ultrasound, and MRI. This one you have a low density lesion above the heart. It causes the apex looks strange. So this is actually a pericardial cyst. Most of the pericardial cysts I see is on the right side, but sometimes it can be on the left side too. So 25% of the patient, so most of them are asymptomatic. So this one, you feel like there's a mass here somewhere. And then on imaging you see this big mass right here, right?
Nhị phải không? Nhị phải với thấp với lại thấp phải luôn.
So this is actually fibrous tumor of the flora. Most of them are benign. So the flora, you know, lines the mediastinal contour, right? So that's nothing. This is a localized fibrous tumor of the flora in the mediastinum. So they arise from the flora. So it's a pericardial tumor. Next one. So this one, you can see, so this is the left atrium, the left ventricle. You can see a mass here. It has something called calcification. And then in this patient, you have tumor extending here. The right ventricular wall should be very thin, like paper thin. But this one has like some thickening there.
Vì răng nó dày hơn.
So this is two different tumors. This is a cardiac fibroma, and this is a rhabdomyoma. This is usually in kids, in pediatric patients. Sometimes they spontaneously resolve by themselves without treatment. So the fibroma, typically solitary calcification, you see a punctate calcification there, mild enhancement, and it will show this is late gadolinium enhancement on MRI. The rhabdomyoma is often multiple, no calcifications. It has minimal to low enhancement and no late gadolinium enhancement. Okay, this one is a very good case. So you can see there is thickening of the right atrium, the interatrial septum. You can see thickening of the left atrial wall. You can see thickening here. And then another thing that's interesting is the pleura is also thickened, right? There's definitely pleural thickening here. And then the thickening goes around the aorta too. Any student think of the diagnosis? So in this particular case, it involves the kidneys, the aorta, the heart, so it's actually involved the kidneys, right? The aorta right here, the pleura, the heart. So this one is rare, but I don't know if you guys heard of this. It's Erdheim-Chester disease. So it's like an infiltrative process. It's a systemic xanthomatous infiltration characterized by non-Langerhans foamy histiocyte infiltration. So if you see something in the kidney involving a vessel infiltrating the heart, then think of Erdheim-Chester disease. We see this one, it's rare, but I've seen maybe a couple cases over the years. This one, obviously, the lung has a whole bunch of nodules, right? And then there's a mass here. There's a pleural calcimatosis here. There's some pleural thickening there. So this is pleural calcimatosis here. And it goes into the lung. So this is an angiosarcoma, which is the tumor of the vessel and the lung metastases. So this is another common tumor I see often actually. It loves the valve. So you can see this. This is the aortic valve, and you can see a soft tissue nodule sitting on the valve. And then this one is sitting in the left atrium. This is papillary fibroelastoma. You see it a couple times a year too. So it's like 80-90% occurs on the valves. And the most common is the aortic valve and mitral valve. And
Ôi chị.
but they can occur on other surfaces. And then you see the mass here in the right atrium with pericardial effusion right here.
Angiosarcoma.
So this is another case of angiosarcoma, and this is another thing that we think of like infiltrated mass in the heart is lymphoma, cardiac lymphoma. It's pretty one of the more common malignancy in the heart. So most the angiosarcoma, most common differential cardiac sarcoma, they're pretty aggressive and they have a lot of contrast enhancement. And then lymphoma, it can involve the heart, obviously. And you can see that in immunocompromised patients. And then they often present with pericardial effusion, and they have enhancement. Okay, so this is, you can see that there's tumor going around like this. And then when you give contrast, this is, you can see nodules, masses here. So this is metastatic disease from, any cancer. And then this is a very scary case. It looks like no, actually no. This is a teratoma under the heart.
Lạ quá không nha. Chắc trong đời không gặp bao giờ. Lạ quá không.
So this is actually an aneurysm. So you get the delay So on the contrast, so it's an aneurysm of the right coronary artery. So be careful, dumb biopsy. And then this tumor right here. This one is kind of atypical because it's kind of adherent to the wall. And then, so it's actually a thrombus. So we do a lot of characterize the differentiate between thrombus and tumor. Because the cardiologist, they call, I think the majority of the cases that we see turn out to be thrombus, not tumor. There's more thrombus for sure than tumor. So, always put in your mind, could it be like a intracardiac thrombus? So a lot of patients with atrial fibrillation and mitral valve disease. So do you do echocardiogram? Anh làm echo. Yeah. Sometimes. But can you tell if it's a thrombus or tumor by echo? Yeah. Yeah. So we have a lot of a whole bunch of cardiac for that indication. Yeah. So the cardiologists they do right, and then they can't help, and they send it to us, and then by the time we do the cardiac MRI, which is like maybe a couple of weeks later or like a week later, it's gone because they put the patient on anticoagulation, Or it's shrink. You see the echo is like 3 centimeter or 2 centimeter, and then by the time we do it, it's like only 1 centimeter. Or it disappeared. A lot of it just disappeared. But they make a lot of patients have atrial fibrillation. They have a lot of problems. Yeah.
And what is the more reliable future to
Okay, so the on certain signal intensity is dark, and then it doesn't enhance, and it's kind of the location too. So usually tumor they enhance late gadolinium enhancement, but the clock is not enhanced. Yeah. And then on the MRI, what you do, so there's two contrasts that you're looking for. One is first pass. So you scan and then you see the contrast go in and out. And then if it's a tumor, then you can see it enhancing and so it drops down. And then you do a 10 minutes delay, and then that's when you do late gadolinium enhancement. And the tumors a lot of times they enhance the clots. So there's a mass here and there. So this is a paraganglioma. It's one of the rare ones. I'm going to skip that. Another. So this is the left atrium right here. So you have the left atrium has two veins. So up here is the superior pulmonary vein. This is the inferior pulmonary vein. So the pulmonary vein has like some substitute masses there. This one is a different patient, has some calcification. So this one, because the calcifications, the amorphous calcification, you have to think of osteosarcoma, and it can occur in the heart. It's very rare. And this is another mass in the atrium. This is very illustrated, kind of non-chronic. And then the patient has a pericardial effusion here, full effusion. So this turned out to be a pericardial mesothelioma, because of the line. Extremely rare, very poor prognosis. Okay, any questions?
Dạ vâng, có câu hỏi gì không? Hôm nay 7 chủ đề thầy vừa chia sẻ